Imagine waking up one day and your usual medication is nowhere to be found. Like, literally nowhere. That's the reality for many people facing the never-ending Adderall shortage. But what if there was another option? Enter Dexedrine, a medication that's been around for years but is now stepping up into the spotlight. Let's explore why this could be a game changer for your ADHD treatment. The Adderall shortage, which began in October 2022, has left many ADHD patients struggling. About 1 in 10 people who use Adderall or similar medications has been affected. This shortage isn't just an inconvenience, it's disrupting lives. As Dr. David Goodman puts it, it would be like ordering glasses and not being able to get them for months. How are you going to function in the world without your glasses? And that's where Dexedrine comes in. This medication has been around for years, but is now gaining attention as a potential solution to the Adderall crisis. Could this be the answer many ADHD patients have been searching for? And who am I to answer this for you? My name is Dr. Sulman Aziz Mirza, triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine, and I've had to reach into my back pocket and prescribe Dexedrine more in the past couple of years than I ever had before. As we explore alternatives to Adderall, a surprising fact emerges. Did you know that 80% of people using stimulant medications like Dexedrine report improvements in their ADHD symptoms? This statistic raises an intriguing question. Why isn't Dexedrine more widely known? Dexedrine, or Dextroamphetamine, is a powerful central nervous system stimulant primarily used to treat ADHD and narcolepsy. It's been around for years, quietly helping millions of people manage their symptoms. In fact, in 2021, Dexedrine was the 17th most commonly prescribed medication in the United States, with over 30.3 million prescriptions filled. So, what sets Dexedrine apart from Adderall? The key difference lies in their chemical composition. Dexedrine is primarily composed of dextroamphetamine, while Adderall contains a mixture of dextroamphetamine and levoamphetamine in a 3-to-1 ratio. This difference might seem small, but it can have a significant impact on how the medication affects the brain and the body. Dextroamphetamine, the main component of Dexedrine, is considered stronger than levoamphetamine. This means that Dexedrine often has more pronounced effects on the central nervous system compared to Adderall. For some people, this could translate to more effective symptom management. But how does Dexedrine actually work in the brain? Like other stimulant medications, it increases the release and effectiveness of key neurotransmitters, particularly dopamine and norepinephrine. These chemicals play crucial roles in attention and impulse control, two areas that often challenge people with ADHD. Specifically, dextroamphetamine works by inhibiting the reuptake of these neurotransmitters and promoting their release from the synaptic vesicles. In simpler terms, it helps keep these important brain chemicals active and working longer, enhancing their effects on brain function. The effectiveness of Dexedrine is backed by research. Studies indicate that long-term stimulant therapy significantly reduces core ADHD symptoms and enhances the quality of life for many patients. What might these improvements look like in day-to-day life? For many people, Dexedrine can improve focus and decrease impulsivity and hyperactive behavior. These are key symptoms that often interfere with work, school, and personal relationships for individuals with ADHD. It's important to note that while Dexedrine can be highly effective, it's not a one-size-fits-all solution. Like all medications, its effects can vary from person to person. Some individuals might find Dexedrine more effective than Adderall, while others might have the opposite experience. The reemergence of Dexedrine as a viable option in the face of Adderall shortage highlights an important point. There's more than one way to manage ADHD symptoms. While Adderall has been the go-to medication for many years, alternatives like Dexedrine offer additional options for those struggling to find the right treatment. As we consider Dexedrine as an alternative, it's important to weigh its benefits against its risks. Did you know that while Dexedrine can significantly improve focus and attention, it's also classified as a Schedule II controlled substance? This classification hints at both its potential and its power. Dexedrine, like other ADHD medications, offers a range of potential benefits for those struggling with attention and focus. Many users report improved concentration, decreased impulsivity, and an enhanced ability to complete tasks. These effects can be life-changing, allowing individuals to perform better at work, school, and in social situations. But the benefits of Dexedrine may extend beyond just managing day-to-day symptoms. Some research suggests that long-term use of ADHD medications like Dexedrine might have positive effects on brain development. This could potentially lead to lasting improvements in cognitive function and overall quality of life. However, it's crucial to understand that Dexedrine is not without its downsides. Like all medications, it comes with potential side effects. The most common issues include insomnia and appetite loss, which can affect a person's overall well-being if not managed properly. More serious concerns involve cardiovascular effects. Dexedrine can increase heart rate and blood pressure, which may be problematic for some individuals, especially those with pre-existing heart conditions. It's essential for anyone considering Dexedrine to discuss these risks with their healthcare provider and potentially get some tests done if indicated, like an EKG, to ensure that there are no abnormalities with their heart. The psychological side effects of Dexedrine are also worth noting. Some users may experience mood swings, anxiety, or irritability. These effects can vary greatly depending on the individual's personality and their mental state. In rare cases, Dexedrine use has been associated with the onset or worsening of psychosis in some patients. For children and adolescents, there are additional considerations. The FDA has issued warnings about the potential for Dexedrine to create new or worsen existing behavioral problems. This includes the possibility of triggering or exacerbating symptoms of bipolar disorder or Tourette syndrome. Given these potential risks, it's clear why Dexedrine is classified as a Schedule II controlled substance. This classification acknowledges the medication's medical uses while also recognizing its potential for misuse and dependence. It's a powerful tool that requires careful management and oversight. The importance of proper medical supervision cannot be overstated when it comes to Dexedrine use. Regular checkups and open communication with healthcare providers are essential. Dosage adjustments may be necessary based on how a patient responds to the medication and any side effects they experience. Despite these challenges, many people find that the benefits of Dexedrine outweigh the risks. For those struggling with severe ADHD symptoms, the improvement of focus and attention can be transformative. It can open doors to academic and professional success that might otherwise remain closed. As the Adderall shortage continues, many are considering Dexedrine as an alternative. But switching medications isn't always straightforward. What if the key to a smooth transition lies in a surprising place? The answer might reshape how we think about ADHD treatment. Changing from Adderall to Dexedrine should always involve medical guidance. It's not a decision to take lightly or without professional input. Your doctor can help you navigate the switch safely and effectively, ensuring you're on the right track from the start. When making the switch, it's important to know that while Dexedrine and Adderall are both amphetamine stimulant medications, they're not 100% identical. Patients might experience similar therapeutic effects, but there could be differences in how the medication works for them. These medications have different pharmacokinetics. That is, they're processed differently by your body. This difference can affect how quickly the medication starts working, how long its effects last, and how it interacts with other medications or substances in your system. Your doctor will take these factors into account when creating your treatment plan. It's also worth noting that the optimal dosage of Dexedrine might be different from your Adderall dosage. Your doctor may need to adjust your dose during the transition period to find the right balance. This process can take some time and some patience, but it's essential for achieving the best results with minimal side effects. One important point to remember is that you should never stop taking Dexedrine or any other medication abruptly. If you decide it's not the right medication for you, your doctor will guide you through an appropriate tapering process to avoid potential withdrawal symptoms. This approach ensures your safety and your well-being as you explore different treatment options. It's also crucial to take Dexedrine exactly as prescribed. Taking too much can lead to an increased risk of adverse effects or potentially an overdose, which can have serious consequences. If you're ever unsure about your dosage or how to take the medication, don't hesitate to ask your healthcare provider for clarification. Remember, the goal of switching medications is to find the most effective treatment for your ADHD symptoms with the least amount of side effects. This process might take some time and involve some trial and appropriate feedback. It's not uncommon to try different medications or dosages before finding the right fit. As we've seen, Dexedrine offers a viable alternative for those affected by the Adderall shortage. It's a potent medication that can effectively manage ADHD symptoms for many people. However, it's crucial to remember that switching medications isn't a decision to be made lightly. Always consult with your healthcare provider before making any changes to your ADHD treatment. They can guide you through the transition, helping you navigate potential side effects and find the right dosage. Remember, What works for one person may not work for another. The landscape of ADHD treatment is constantly evolving. As we face challenges like medication shortages, it's more important than ever to stay informed about your options. By working closely with your healthcare provider and staying up to date on new developments, you can ensure you're getting the best possible treatment for your unique needs. Thank you for watching, and make sure to like, subscribe, and share this video if you found something useful from it. This Adderall shortage is impacting all of us, from patients to doctors, but we will find a way through it, hopefully. And if you want to learn more about the why of the shortage, make sure to check out the video below. Let's just say the DEA doesn't want you to watch it. Until next time, be safe and be well.